I've been leading a project on the ethics of trust, which is part of a very large-scale EU Horizons 2020 project run by Maria Bagramian from the School of Philosophy. Policy, expertise and trust, multiple international partners. Initially, the idea of the project was to develop a kind of toolkit for policymakers to think about how to establish, improve the community's attitudes of trust towards expertise, towards trust in scientific experts, but also trust in government experts. Right at the beginning, the project was going to be about climate change, but then the COVID-19 pandemic came along, and at that point, the focus shifted very dramatically because we had the perfect case study in COVID-19. The same issues about trust and expertise, which arise for climate change, very, very much in everyone's mind when it comes to COVID. So suddenly everybody is talking about trust because of the COVID-19 crisis. Various things that the project's been doing with its different international partners. We've been constructing behavioral psychological experiments to see what influence people when they're on the internet, when they're looking at, for example, conspiracy theories about vaccines, or when they're looking about whether, not just conspiracy theories, just the evidence about whether vaccines are safe or whether you should wear masks, all the different things that people are trying to work out from multiple sources of information. And the question is, what is it about experts that can kind of give them the confidence to trust experts? Large-scale international surveys about people's attitudes towards experts, especially experts in medical experts with respect to COVID-19. And we're going to finish with a big citizens forum, in fact many citizens fora across different countries, where people are going to essentially develop their own experience through COVID-19 of how their experts were treated and whether they trusted them, and look at the toolkit that we will have developed in the project to see whether that's going to be effective in the community. One piece of public engagement we've been doing, especially with respect to COVID, is a series of public lectures where we've had people talking to us about, for example, vaccine hesitancy and whether it's not necessarily just a product of ignorance, which some people assume it must be, but it's actually the opposite in many people's cases, that they are thinking in terms of themselves being the experts, and they're getting so much information that they think they can work it out for themselves without having to appeal to experts. Or, for example, conspiracy theories. And conspiracy theories are a big issue when it comes to online treatment of the COVID-19 epidemic.